This is Karen Ranzi of superhealthychildren.com and feelfabulous.with-food.com, a holistic health coach and award-winning author and speaker. And I'm so excited today to be here with Dr. Tumi Johnson. And Tumi and we both spoke at the Woodstock Fruit Festival, which in my view is like the best health festival of the year. And Dr. Tumi is an integrative medical doctor, and she's also a dancer. And so I'm going to be asking Dr. Tumi some questions today about health, nutrition, pregnancy, raising healthy kids. And she just recently had her own child. And so we're going to hear about that. So Dr. Tumi, welcome to Super Healthy Children.
Thank you so much, Karen, for having me. It's an honor, really, to be interviewed by you.
Thank you so much. I'm really excited, and especially to have the perspective of a medical doctor on raising healthy vegan kids. So I have some questions for you. What brought you to a whole foods plant lifestyle?
That is a beautiful question. And the short answer is brokenness brought me to that. I was in medical school at a fantastic medical school, getting a great education. I come from a wonderful, loving family, had wonderful friends, but I was struggling with health issues, including asthma, eczema, severe depression, disordered eating behavior. And the depression got very, very bad. And I got to the lowest point one can get, I believe, in this life. And healing from that, I started doing my own research. I was in medical school and getting great allopathic education, but not a really, I believe, holistic education, especially not one in nutrition. Long story short, I finished my residency in internal medicine at NYU, and I joined Doctors Without Borders and worked as a field physician in West Africa, field doctor. And the whole program was about helping malnourished children, helping to heal and treat malnourished kids. And that's when I started learning about nutrition. I got a nutrition education from that. And I got to see that when you get out of the body's way and you give the body, these were little children less than 5 years of age, giving them good food, getting out of the body's way, they just flourished. So I came back to New York City and took a look at my own diet and started asking some very hard questions to myself. And doing more nutrition research, I joined the Institute of Integrative Nutrition. That's when I became a diplomat of the the board of Integrative Holistic Medicine. So more nutrition research. And I had to change my diet. At that time, I had been a long time pescatarian, eating lots of fish, eating lots of dairy. And the data, when I started looking at the data and the science, it was clear, looking at luminaries like Dean Ornish, Caldwell Esselstyn, C.C. Colin Campbell, so many people who have done the science around this. It was clear to me that plant foods were what we were designed to be eating. And I'll go so far as to say fruit, we are frugivores, and we can talk about that later. So I started to do that. And within 2 weeks of stopping dairy, asthma, which I had been dealing with for 30 years by that point, was gone. My eczema went very soon, and my depression soon after. So that's a long answer, but my brokenness and then searching for healing and doing the work in nutrition and being able to see the children that I was taking care of flourish led me to this path. And I've been on a fruit-based, raw vegan lifestyle in that for now 9 years and flourishing.
Wonderful. And so your passion is very in sync with mine, because I've been coaching and living this lifestyle for 26 years as a raw
Wow.
vegan, and 31 years as a vegan. And these same people had a tremendous amount of influence on me. The very, very clear medical research that's all over the journals, if people would look. But,
Yes.
we're being thrown a lot of really good marketing out there. So people who watch TV are learning something very differently from what the real science is. So I very much appreciate your perspective and what you've
Mm.
learned. Um, when did you realize that it was important to go to that next level of more raw living food? That it wasn't only about being vegan, because we both know that you could be vegan living on French fries and not be very
Absolutely.
healthy. So when did you really get that it was the live food, the real food from the garden?
Great question. Again, I think the science talks a lot about unprocessed whole plant foods being the healing, not processed Oreos and French fries. And that was clear in the scientific literature. But as you said, the living foods aspect, for me personally, it was when I went to the very first Woodstock Fruit Festival in 2011. I was living in New York City at the time. I learned there was going to be this gathering of people who are going to be eating vegan and eating living foods. And something inside of me said, you need to be here. And so I took a bus up and I read 80-10-10 that first night and saw these people, many people who were just glowing. I mean, I know that might seem like a woo-woo term, but light from within coming out. And between the book, my previous scientific knowledge and research, which was very clear, whole foods, plant-based, plant foods, and fruits clearly is that, living foods clearly are that. And when I was eating that food at the festival, I felt it. I felt the difference. Um, After the week was up, it was clear that I wasn't going back. I just felt so good. I want to share that I am Nigerian American. I spent the first 12 years of my life in Nigeria. We had mango trees and grapefruit trees, plantains and bananas, everything abounded. So I come from a place that is replete in tropical fruits. So I had this, I think, primal memory, primal understanding that this was my food. It really felt like coming home, Karen, when I ate that food. And I said, I don't want to go anywhere else. If anything, I've strayed from this way. And now I felt like I returned to home. That's when it was clear for me.
That's wonderful. That is wonderful, especially when you have this food all around you.
Yeah.
Um,
Yeah. And that was in the past. Now I was living in New York City, but I had the memory of
yeah,
that. And
yes. It speaks to me because, as much as my children, my son had asthma and chronic ear
mhm,
infections up until the age three, and I went to a raw living foods lifestyle and transitioned my family when my kids were 3 and 5. And
amazing.
the amazing healing of his asthma and chronic ear infections and allergies in such a short time was so incredible. But then later on, as teenagers, they went way off, and they both came back later on in their young adult years. And so when we have this early base of knowledge, like what you had and like what my kids had, then we know it's deep inside. Even if we
Yes.
do go off, we somehow,
Yes.
something gets triggered in our subconscious, and we come back because we know that that's the best way to live. It's the most natural way to live. It's what our bodies need. So that's what
Absolutely,
happened for you.
absolutely. And I just want to share one really quick thing is just coming to me to share is, I think I was thriving on that food, but soon I was also introduced to things like dairy as a child. And most of the world is lactose intolerant. And definitely, if you are of certain descents, including West African descent, you are most probably definitely lactose intolerant. And that definitely did a number on my mucosa, on my respiratory tract, on my skin, which is the eczema and the asthma. And so it is about kind of coming back to the basics, to what we as a species were designed to eat, and letting the rest go.
Yes, for sure. And we really do have to look at how the human being was designed. And, you know, we don't have these fangs and we don't have short digestive tracts. You know, we're not meant to eat food that comes from an animal. I mean, if you look clearly at our structure. So, as a physician, and coming from, I know you come from a family of
Mhm.
physicians. How do others in the medical community, have you been in touch with people in the medical community, and do they frown on your way of teaching? Because really what you're doing, it's more preventative, and it's not, you know, you're not treating with drugs.
Really great question. And I'll just share with you that what my work looks like now, because that will give an idea of what's happening. So the journey continues and keeps evolving. And after I changed the way I was eating and saw such a huge difference, I couldn't stay quiet. I had to start talking to my patients about it. I started asking them what they were eating, and I started doing more research, and I started spending a lot of time in the clinic and the hospital talking to my patients about diet and seeing incredible results. Diabetics no longer meeting the criteria for diabetes after 2 weeks on fruit-based plant, whole foods, plant diets. Um, People with overweight, cholesterol, depression, anxiety, the list goes on and on and on. I've continued to have the pleasure of seeing that result for all these years I've been doing that now. My work now looks like I have a holistic health practice where I see clients and patients either in their home if they're near me or through Skype consultations. Um, and I also create healing dances, which we can talk about later. But I want to talk about the preventative aspect. So I am talking to people a lot about preventing the problem in the first place. But most people who come to see me, Karen, already have the problem. They already have issues with hypertension or obesity or depression or anxiety or an eating disorder or an autoimmune disease. And what I'm doing then is I'm guiding them, because they're the ones who are doing the healing work, not me. Their bodies are the ones that are healing, their minds are the ones that are healing, but I guide them through, in part, big part, plant-based nutrition to heal. So I just want to make the point that I do talk about prevention, but I'm doing a lot of treatment with the food, as well as with things like yoga and mindfulness and other things, and really trying to avoid pharmaceutical medication and helping them wean off their pharmaceutical medication. And what I love about being a doctor is I know these medications like the back of my hand. When they tell me I'm on this and this and this, I can say, fantastic, here's how to safely start decreasing that, and using nutrition, using movement, using mindfulness to take the place of that and take you to your next level in terms of vibrant health. To
Wonderful.
answer your question, to
Yeah.
answer your question about how my colleagues see that, um, you know, I think that doctors get a bad rap, and I am blessed to have beautiful friends who I made in medical school and in residency and beyond that. And I think the bottom line is the proof is in the pudding. You know, my friends start saying, "What are you doing?" And I have friends now and other doctor colleagues or people who have known me who've now become my clients and patients who are physicians. The world is changing, the paradigms are changing, and physicians themselves know that it's not just black and white. It's not just about popping a pill anymore. It never was, but
Yeah.
now they're becoming more understanding of that fact. So I've had overwhelmingly positive feedback because, again, the results, you can't argue with the results.
Right.
The few and far between who um, frown upon it or poo-poo it. I remember, I'll never forget this. I was in a medical conference, and people were eating things from the buffet, and I was sitting with a bunch of other physicians, and I had a big plate of watermelon. I was just going for the watermelon. And there's a physician next to me, a little older than me, and he said, "Whoa, you got to be careful about your blood sugar with that." And I said, turned to him and I said, "Oh, what do you mean by that, sir?" And he said, "I mean, that's a lot of sugar you got there." And I tell you, the next 15 minutes were just wonderful to open his eyes to that. But he wasn't buying it. I said, I will gladly send you the scientific evidence on this. And he just was very resistant. There will always be people who are resistant because it breaks too much open their paradigm, their status quo. And I think the best thing we can do is just be the example, and the people who are ready will come.
That's right. That's right. And you planted a seed, and so, and I
Absolutely.
do really believe that today there are many medical doctors, many more medical doctors, who are becoming open to a plant way of eating and healing, and they're understanding the extreme benefits of it. So
Yes.
that is really key. I mean, we have a plant-based doctor right in my own town, so it's really exciting. And many of them even know that I'm a holistic health coach, and that this is what I've been focusing on for decades. So some of them have, like, there's a local endocrinologist who is seeing clients with diabetes, and sends some women with type 2 diabetes to my 5-week program. And
Perfect.
so it's a great way of medical doctors wanting to know more. There was a woman with
Yes.
thyroid problems who came to my 5-week program, and it completely turned around for her. And she goes to her endocrinologist, and her endocrinologist was giving her the tests for thyroid, and said, "Whatever you're doing, just keep doing it, keep going." So that's great, and I love working with open-minded medical doctors. Now, when did you hear about my book, Creating Healthy Children? And what what in that book did you what did you take from that?
And this is why I started by saying I'm so honored to be interviewed by you, because this book was so instrumental in my pregnancy journey and in my and since then, since having my beautiful baby boy. So I think I heard about it, Karen, maybe in 2013, in the Woodstock 2013, and I think you were there. Um, and so I knew that you wrote this book, and I just had in the back of my mind, I was, just things you tuck away. It just wasn't the time at that time. I hadn't met my beloved husband. I wasn't interested in children at that point. Fast forward a few years later, and I had gotten to a point in my life where I knew that it's so important to surround yourself with the people and the books and the media that nourish you, body, mind, and spirit. And so I'd been raw vegan at this point when I got when I got pregnant for, I think, 7 years at this point. And I knew I didn't want to just go down the path of standard um, media and standard ideas around pregnancy. Didn't fit with me anyway, because I got pregnant when I was 41 years old, easily. And I think part of the ease around that was my diet, for sure.
No, definitely.
Um, so I didn't want to be told, "Oh, you are advanced maternal age," which is the term they use, and there are all these issues you're going to have or could have. I wasn't interested in that reality. And so your book came to mind, and I thought, let me just get books that I know will support me and guide me in having a healthy pregnancy and healthy birth. And so I downloaded your book onto my phone through Kindle, and I started reading it. And there's so much I took from it. I mean, I think if people who are watching this who haven't gotten your book, I think just to say it was so helpful for me. And I'll share a couple of things. One big thing were the stories you shared from other families who were going through birthing and pregnancy and infancy, having children, talking about weight gain during pregnancy, what is okay as a raw vegan, how to nourish yourself during pregnancy, how to nourish your child after you've given birth, how to navigate social situations. And hearing your story, Karen, it just was inspiring, it was uplifting, it was affirming. I turned to that book over and over and over again. If thoughts would come into my head like, what am I doing here? I'm all alone. I would go to that book and remind myself, this has been done. This is being done by many vibrant, healthy people. Between your book and looking at just, again, the scientific literature, and looking within. I always talk to people about going within. Every time I meditated, I would just feel a sense of peace. I would feel the truth of the words you were sharing, and I would keep on. My pregnancy was so easeful because of it. I can share a little bit more about that if you want.
Yeah,
And the
that's the
birthing
next
experience.
question, actually. So
Okay.
that's perfect.
Yeah.
Next question. Tell us about your pregnancy.
My pregnancy was 10 months, because 9 months is not true. It's 10 months, was 10 months of joy. Really, it was, I eat a fruit-based raw vegan diet, and even more so during pregnancy, feeling this life growing within me, it felt even more right to be eating this way. Before, I was doing it for my own health and for my peace. But now I was like, I have a child, and I know this is the best, this is the optimal way to nourish my body and to nourish this child within me. And I was affirmed, not just by your book, but how I was feeling and the lack of symptoms that are just told to you that are just normal during pregnancy. I had no morning sickness. I had as it progressed, I had no issues with swelling of my wrists or my feet or my ankles. I had no problems with high blood pressure, no problems with what else is common? Lots of back pain and joint pain, severe fatigue, none of that. I I I was running. I was doing jogs. I love running. I was running easily till about 6 months or 7 months being pregnant, and then I stopped because I preferred the walking. I swam every single day. I danced every single day easily, and I ate whatever I wanted, fruit-based living foods. My body just knew what it needed, even more so when I was pregnant, I believe. And what else did I want to share about the pregnancy? It was such a joy. I loved it. I was so
Yeah.
happy.
A lot of the women who I've spoken with who have had healthy raw vegan pregnancies, and of course, you know, it has to be a properly planned one. There have been times that that it's not properly planned, and then it doesn't work out as one would want. So, you know, obviously you were eating whole foods, because
Yes.
raw and vegan today, you know, could be processed raw foods too. There's a lot of packaged stuff.
Good
But
point.
eating a lot of whole foods, you know, the women who I've spoken to and the people I've interviewed for creating healthy children, their pregnancies were what they call ecstatic. They were just beyond joy because they didn't have all of the health issues. They weren't constantly running to the doctor for symptoms. You know,
I had
you
no
didn't have
symptoms.
gestational diabetes.
No,
You know?
nothing. No preeclampsia, nothing. I didn't go to the doctor for anything. I was in optimal health. And it's a great point you make. It has to be a healthy, I call it a garden diet, you know, an unprocessed Mama Gaia diet. And I have a video on my YouTube channel that's a what I eat in a day as a raw vegan pregnant woman. And I shared about that. And it was fruits, lots of greens, small amounts of nuts and seeds. It's that simple, but there
Yeah.
it is. There it is.
Beautiful. Beautiful. So happy to hear that. It just excites me and makes me happy because this is our future generation.
Yes.
And this is what we are giving to when we're pregnant. It's like, this is everything that we want for the future. And it's
Mm,
going to affect multiple generations. So what you're doing is fantastic.
thank you.
So can you tell us also a little bit um, about your childbirth? Now, natural childbirth is becoming less common today. Um, I even know women who make appointments to have C-sections.
Yeah.
They just don't even want to birth naturally. They just think it's easier. Um, can you tell us about your birth?
I'd be honored to. I created a whole poem dance. I create these healing dances. There are dances that I create so that the person who's watching it feels an instigation, an igniting of healing within them. And so one of the healing poem dances I did was called Creation Story. That's all about the birth story of my baby boy. And I shared it because I think that a part of that story is the idea of people saying, you can't do this, our bodies are not strong enough as women, you're too old as a woman to give birth, whatever it is, and transmuting that into yes, 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 we are strong. Yes, we're capable. Yes, our bodies were built to be able to do this. And that was my experience, Karen. Again, if you're nourishing your body the way it's meant to be nourished, your body can do extraordinary things. And that was my childbirth experience. It was orgasmic, it was transformational. It was also 3 days long. And I want to say that because I read a lot of beautiful stories of raw vegan women getting their baby out in 2 hours, 3 hours, whatever. And I made sure I didn't get attached to that idea, but I think I was having this expectation it's going to be very short. And I want to share that I had the childbirth that I needed to have. I had been somebody who had been struggling for a long time in my life with issues around safety and feeling that all is well from trauma as a child. And I had that childbirth, I think, be so long because your body really needs to feel all is truly well, all is truly safe before we bring this being earthside. So those 3 days were a beautiful meditation in me coming to terms with how safe do I feel bringing a child in? How safe do I feel the world is for my child? My point is, sometimes it's beyond the food. But I'll share with you, it was a 3-day marathon. I would not have survived 3 days at home, birthing and having an orgasmic experience. I don't believe, had it not been for how I was nourishing my body. I was sipping, the second day I was sipping, my husband was juicing beautiful tangerines and oranges for me, and I would sip on that to get me through. So I was nourished by the best fuel ever to go through that 3-day marathon. And it's what I needed to have. So I wanted to share that because sometimes we can have this expectation of how things should look like. But it was a beautiful, healthy birth. It was a free birth. We had the baby in this very room, just my husband and I had a a birthing tub, and it was an incredible experience. And
Wonderful.
I want to also say that people who are scheduling C-sections, I believe every woman has the right to have the birth that she deems healthy for her and her child. That said, I think many women don't understand that the physiologic birth, if you're healthy by nourishing yourself, body, mind, and soul, if you're healthy and you get out of the body's way, that means not medicating it, your body will flood you with the hormones needed and go into a cycle and a rhythm that's needed to have that baby move down beautifully from uterus through the cocoon of your cervix and out. And that is what I experienced, Karen. It was so incredible to feel my body so intimately, to feel at every step what was happening with this child. My third eye was blasted open. I could feel my internal organs in a way I'd never felt before because I wasn't medicated, because I was fully present, because of those God-given, body-given hormones.
Wow, that's so beautiful. So, so beautiful. Ah, I just love hearing this story because, in the hospital, um, if you go past a certain time, I know that, even though I was with wonderful midwives at a beautiful birthing center, um, with my second child, they got scared when I went beyond 2 weeks of the expected date. They got scared. And even, if a woman is having contractions and she hasn't given birth in a certain amount of time, they're already, pushing pitocin
Yeah.
and wanting to plan the C-section. So the fact that you had a planned home birth, and it shows that, you can go way beyond your time. The baby comes when the baby's ready to
Hmm.
come. That's
Absolutely.
fantastic. Um, how old is your little boy now, and how are you feeding him at this time?
So he is 6 months old, and I'll just share. I think there's one thing you may have the question, but I want to share one thing also that can alarm even midwives, right? Is weight gain during pregnancy. And your book was also really helpful for me because you shared about the fact that you may not gain the normal weight that people who are eating other diets gain. I gained about 15 pounds during my entire pregnancy, but I knew I was super healthy and vibrant. My energy levels were great. I was dancing. The day my baby boy started coming down, I was dancing. So I just want to bring that up because people can have fear around weight gain, and it's if again you're nourishing your body the way it should be nourished, eating whole foods, unprocessed foods, living foods, and enough calories of that, you are going to be fine. I want to share that. And now he also, I have small hips. I'm a very slender woman, and he came out at 6 point something pounds, vibrantly healthy, and quickly started to gain weight just on breast milk. And we're living in the Canary Islands, and I would hear all the time, "Ah, gordito, gordito," which means little chubby one. I still hear he is just cheeks and beautiful muscles, and all on breast milk from a raw vegan mama. So he's doing great at 6 months old.
Wonderful. Fantastic. Yes, I've seen this time and time again. My own daughter, who just had a baby, who just
Mm.
turned 3 months yesterday, she also, didn't gain that much weight. And she was working with midwives, and they also were very, very concerned that she wasn't gaining the weight that they see in women who eat differently. She had a beautiful pregnancy. She had a beautiful, beautiful baby. And she did end up going to the hospital because of this. And thank goodness she had a doctor who was really like a hippie doctor. He like came in and he saw her birth plan. She was very concerned, and she did not want to have a C-section. She wanted to have a natural birth, and he fulfilled her birth plan. He was like, "We're going to have a baby in here." and
Beautiful.
yeah, and she needed to go into the shower at certain points. She went into the shower. She came out of the shower. He was on the floor with her.
Beautiful.
He did whatever she needed to do, and she had a beautiful baby naturally with no drugs. And same thing, came home, and that baby at 3 months is the plumpest, just on breast milk, beautiful big cheeks, and looks like a little fat baby, but it's all breast milk. It's all
Yeah.
natural. No
Yes,
chances of obesity later on from breast milk.
exactly.
So yeah, so it's also wonderful to hear your story and to feel, that more doctors need to realize that women don't need to gain, 35, 40 pounds and over. That's like actually not safe
Hmm.
to gain all that weight.
Hmm.
Um, So, are you practicing attachment parenting, which is really the basis of what I wrote in Creating Healthy Children, meaning skin to skin contact, breastfeeding, sleeping with your child, like really attaching to your child and not worrying that you're going to spoil your baby.
Yeah. The answer is absolutely. And even before I had children, I resonated with that. It just, um, I studied when I was in college. I studied, my focus, my majors were in dance, mental biology. So I was studying animals and birds and what it's like in nature. And we're part of nature. And it just, you don't see in nature um, mammals, animals having children, having their babies, and then putting them away from them. Um, and it definitely didn't make any sense. It didn't feel right for me when I had my child. I do want to say right off the bat that, again, whatever choices a mother and a father makes, I in the vein of love, is their responsibility, is their right. For me and my sweetheart, my husband, it was clear to us, definitely co-sleeping or sleep sharing, skin to skin, and I still do it. Right now, my husband is doing skin to skin with our baby, walking through the woods as we have this conversation, but skin to skin always, breastfeeding. He's always, and especially the first 3 months, the fourth trimester, he's like part of me. And when we sleep at night now, we sleep in the bed together, uninterrupted. I have great sleep now. He sleeps through the night, but that means he's cuddled next to me, and whenever he wants to, he just turns his head, suckles a bit if he needs to, and goes back to sleep. Nobody gets interrupted. It's a beautiful way, if you resonate with it, to, I believe, parent and to instill, I think, in my child, parent to wake up in the morning and watch his face, and then he wakes up and the first thing he sees is me and my husband, and he just smiles. I can feel how safe and cared for he feels.
Wonderful. So wonderful. Um, all women should really know that this is how they're going to get the most sleep. I think that women always feel like they're going to be up all night and they're going to be spoiling their baby if they have their baby next to them. But just realize this is a new world for your child. Like, your baby doesn't really understand where he or she is, and putting them in a crib down at the end of the hall to sleep alone is quite scary and fearful, really fearful for them. So taking the baby and doing what Dr. Tumi does, having the baby right next to you, and it gets less and less as the time goes on. They nurse a lot at the beginning, and as the months go on, it's less and less, and you actually end up getting more sleep.
That's been my experience. I mean, we get a full night rest now, and our sweet boy is so, he just is, everyone says it all the time, he's so alert but also calm. There's no sense of agitation during the day. Every baby cries, I'm not saying that to cry, but it's just easy, and it gets easier. Even already I can say that. And I didn't know that. In my head I thought, oh, maybe co-sleeping is going to be more work, but it's worth it. But interestingly enough, even if your only reason is actually selfish, I don't have to get out of bed multiple times during the day, flip on a light, screw up my melatonin levels because I have this harsh light, find my baby, try to nurse him, put it back, pad down the hall to my room. There's none of that. It's dark. It stays dark. I wake up, everything is nice and balanced. My husband wakes up. So it's been a blessing in many ways.
Yeah,
Doing this.
wonderful. So one more question, and then and then I want to ask you if you have anything additional you'd like to add. What are other areas of parenting beyond the raw vegan nutrition that you value for
Mm.
for children, for raising the healthiest kids?
It's still a journey for me, and I'm a young mama, but from my experience, having had the honor of working with mamas, especially when I was in Africa, when I was in Haiti, um, and helping these children, as well as seeing my dear friends, reading your book, seeing the literature, I believe outside of just physical nourishment, the attachment parenting of, again, skin to skin, giving them all the hugs they want, because you can't spoil a child. Let's just get that. Spoil a baby. You can't, so lots of love. Really seeing your child as a sovereign, independent being, not somebody who you're there to control or tell what to do, but is here as his or her own self in the world, and that we are humbled to be nurturers of children, and they teach us just as much as we teach them, if not more. So I think coming with that sense of humility, with lots of love, with an open idea of education, and we can get into that another time, like about unschooling or homeschooling, and um, um, the idea that a village raises a child, that it's not just me or my husband, but it's whoever he's coming in contact with, and taking that with a lot of responsibility and with openness and with gratitude. Um, I think all of these are part of parenting. But again, I'm young in the journey. It continues to teach me every day, but I'm excited about it, and thankful again that your book, as well as other books that are so open and mired in good science, good literature, and amazing experience, can be there to guide me along the way.
Wonderful. Thank you so much, Dr. Tumi. This has been really so fantastic. I love for my audience to experience medical doctors who are
Mm.
also practicing this in their own life, who are also practicing attachment parenting, vegan and raw food nutrition, which cares for themselves and for their whole family. And these children are going to be so well adjusted. That's what I
Mm.
see. Children who have been held against their skin, mother's skin especially early on, they are emotionally, mentally, and spiritually healthy. So it's beyond just the physical. It's not only the food. And so that's a
No.
whole another area of health that's so wise and important. Some people have asked me, why did I put attachment parenting first on my subtitle?
Mm.
The book is Creating Healthy Children Through Attachment Parenting and Raw Food. Some people involved more with nutrition had said to me, why would you put attachment parenting first? And I said, because you have to have attachment parenting in order to have really healthy children, especially their emotional health is so, so key to who they are.
I
Um,
love that.
so I love hearing how you're attachment parenting. That's wonderful when, at a time when so many doctors talk about separating from your children.
Yeah. Yeah.
So thank you.
The other thing about nourishment, I'll just say really quickly, is nature and movement, and we already do that with our baby. So getting him naked time in the outside, walking in the woods with him every day, swimming in the sea, and just movement. The things that nourish us as adults. He's the same species as I am. He sees his father and I play and do acro yoga together, and me dancing. I dance with my baby every day. Like, I think these are things to also share with your child. The things we know that help to nourish us outside of food, share that with our children also.
What a beautiful thing to do with your child, and
Mm.
to expose your child to. And so do you have anything additional that you would like to add to say to our audience, and how can people find out more about you and get in touch
Mm.
with you? And I've seen some of your beautiful dance videos.
Thank
So how can
you.
people find out about all that?
I don't have anything else to add except, again, gratitude for the work you do, Karen, and your presence and just being in the world. Because this woman so benefited from that. My son benefited from that. So the work you do advocating for children and their parents to lead vibrant, healthy lives is really a blessing on this planet. People can find out about me through my website, drtumijohnson.com. There, it's a portal into all the things I offer. I have a YouTube channel called The Poem Dances, all one word, in which I share my dances as well as holistic health tips. I have a membership program for people who are interested in doing more work with me, and you can work with me one-on-one on your health issues to be led and guided and nurtured to heal holistically from the inside out, I like to say. So you can find me on drtumijohnson.com or the Poem Dances on YouTube and Instagram. I have a book called Delicious Healing that I'm really proud of, that's about my healing journey, but also shares 7 aspects to deep healing that I believe are vital, including nature, including self-love, and definitely nutrition.
Ooh, that sounds beautiful.
Mhm.
Wow. Thank you so much, Dr. Tumi Johnson.
It's
It's
been a pleasure.
wonderful to have you here. Thank you so much for what you said about creating healthy children and the benefits that you got from that. Um, I am so happy that I could give that to the world. That was my life's work, that book.
Mm.
7 years of writing, researching, and editing, and just to hear that that you got so much out of it, and that it helped you with your own pregnancy, and and hopefully those ideas and thoughts and the research that's in that book will always be with you. And I thank you very much for that, and I hope that my subscribers will definitely go and check out your information. And thank you so much for being on today.
Thank you, Karen.
All the best to you.
And to you.